In this video, I'm going to demonstrate how to pull up your medication from the vial using your syringe. To minimize your risk for infection, you're first going to want to clean the surface area where you're going to be pulling up your medication. You can easily do this by using an antibacterial wipe or spray. Next, you'll want to wash your hands with soap and water for a minimum of 60 seconds. Next, you'll want to make sure you have all of the supplies. You'll need an alcohol swab, your insulin needle, and your medication. So first, I want to familiarize yourself with what the syringe looks like. You will have an orange skinny cap and an orange fatter cap. The orange fatter cap, you just simply pull off the cap and you can always throw it away. What that was covering was the plunger of the syringe. To access the plunger, you just simply pull back. Next, the long skinny orange cap is what is encompassing and covering the needle. So as you can see here, it has the needle. So depending on which syringe you get, sometimes it goes all the way to the 100 mark, and sometimes it might just only go to the 50 mark. Units are smaller than mLs. 100 units is equal to a total of 1 ml, which is shown here on your syringe. When you measure the amount of medication that you need, you'll always use the very flat top part of the plunger to measure the amount of medication you need. So for example, if I need 30 units of medication, you can see here that I am using this top ring here as what I am using to guide my dosage. This top part right here, the very, very flat top part of the plunger. So the next thing I want to make sure I clarify is that it's very important when you draw up your medication to prevent air bubbles. And to do that, you want to put some air from the syringe into the vial. To do that, it's very easy. You just pull back on the plunger and there is some air. How much air do you put in? The amount of air you put in, you at least need to pull back an equal amount of air to what you are pulling from the medication or greater. So for example, if I need to draw up 30 units of medicine, I would pull back to the 30 mark or anything greater than that. Next, anytime you receive a brand new vial in the mail, it will always have a little stopper cap. Sometimes the caps are blue, sometimes the caps are gray, and in this instance, the cap is gray. So it's very easy to get rid of the cap. You just use your thumb and flick it off as such, and it's off. You then will take this cap and throw it away. Before accessing the vial, you will always want to clean the top rubber stop part of the vial for a minimum of 10 seconds. You'll take your alcohol swab and go ahead and clean for a minimum of 10 seconds. And as you can see, now my vial is ready to be accessed. If this is your first dose of semaglutide, for example, you will be using and drawing up 10 units. So the first thing I need to do is pull back air to prevent air bubbles. So I've pulled back 10 units of air. I then am going to take the cap off and access my vial. To do that, you just simply push the syringe into the vial at a 90-degree angle and push the plunger down. Next, you're going to completely invert the vial, so turn it upside down and draw your medication out. Turn the vial over and wiggle your fingers down to where you can easily access the plunger. So again, to demonstrate, you put the syringe into the vial, you push the plunger down for air, and then you simply just invert the vial and pull back the amount of medication that is needed. And as you can see here, because we put air into the medicine or into the vial, I don't have any air bubbles. If you do have air bubbles, there are things you can do to get rid of them. Sometimes you can just pull back some more medication, and then it will even out the bubbles. And then at that point, you just push the plunger up until you have your desired amount. Once you have your desired amount, you turn the vial over and simply pull out the syringe. Next, you will then take the cap and put it back on the syringe. Your syringe is now ready for injection. For subcutaneous injections, you are able to inject in 3 different spots: the fatty tissue area of your underarm, the fatty tissue area of your stomach. Here's your belly button. You can inject here, 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 or here. You can also inject on the fatty tissue part of your leg. So the top part of your leg has the quadricep muscle, and above that you should have a decent amount of skin that you can pull up, and that is fatty tissue. So again, you can inject in any of those areas. Prior to injection, you will always want to make sure you clean the skin site for a minimum of 10 to 20 seconds.